Research conducted in Canada, the United States, and internationally has shown that 20 to 50% of adult men and women, including physicians, have experienced adverse childhood experiences ACEs.
Those who have had these experiences are more likely to develop alcoholism, substance abuse problems, depression, and are even more likely to commit suicide than their counterparts who have not experienced ACEs.
Adverse childhood experiences ACEs are various traumatic incidents from someone's childhood, such as someone's experience with violence, substances, sexual experiences, being neglected, physically abused, verbally abused, that creates a relapse in someone's life.
Adults with ACE histories were common, with one category of ACEs tending to predict another category of ACEs. 1 out of 8 adults has an ACE score of 4 or more. And the higher someone's ACE score is, the greater their risk is of developing mental, physical, somatic, and behavioral problems.
For example, physical, sexual, emotional abuse, someone who lived in a home where there was violence, substance abuse, mental illness, or incarceration have a strong and graded relationship to many of the leading causes of death in adults, as well as leading causes of chronic diseases, mental illness, health-related quality of life, and even propensity for becoming a victim or perpetrator of violence.
While you are watching this video, consider subscribing to our channel.
The emerging stress and fear-reward neurobiology in the developing brain may be programmed as a result of the increased number of adverse childhood experiences ACEs, which, together with compounding bad behaviors, may be mechanisms that link childhood events with adult health outcomes.
For the most part, the effect of adverse childhood experiences, ACEs, on adult health and well-being is fairly unrecognized in the general medical aspect. It's as if there's really no integration of this particular knowledge in the overall general medical practice.
Then, far as the direct impact this may have on the medical field, physicians in general aren't equipped skillfully enough to be able to treat and diagnose individuals who have been victims of ACEs. Also, a vast majority of medical field physicians do not go in far enough in patient history regarding Ask the ACEs question. It has been over a decade since the idea of coursework on ACEs was first suggested for physicians. Those with heavier ACE histories turn up in primary care doctors' offices more often, have more specialty referral, use more health services, and have worse quality of life.
Part of the potential for understanding pediatric ACE history is to have improved medical health outcomes. Many physicians may not have the time or communication skills to ask about ACEs, and so ACEs are rarely self-disclosed. Information does not come out unless the patient is prompted, and even then it does not often come out. There are a few factors that may influence whether or not ACEs are actually disclosed by the patients when the physician appropriately solicits the past medical history.
The patient may be more likely to disclose their ACEs if there is trust in and support from the physician. If the physician is providing patient-centered care, or if the physician is providing patient-centered care and focusing on patient safety.
Female survivors of sexual abuse are also more likely to disclose if the physician is more supportive in the care provided.
Many interventions appropriate for a family physician's office can reduce the burden of health issues that have persisted for years once disclosure has occurred. Screening adult patients for childhood trauma is not necessarily a common practice among community family physicians, but a study has reported impressive results.
Residency programs frequently make no inclusions on how to screen for adverse childhood experiences, ACEs, in the training, and subsequently, attendings have greater knowledge,
confidence, and screening rates when compared to residents. Family physicians often have patients they care for that have unhealthy habits, and those habits are what keep them unhealthy. This can be smoking, overeating, drinking excessively, abusing substances. And a huge reason for people is avoiding regular health screenings like mammograms and pap tests. Medical professionals typically focus on treating a single behavior or disease, ignoring the past or the root of the problem, rather than the root cause of the issue at hand.
Emphasis on adverse childhood experiences, ACEs, is necessary for the success of future doctors. The biggest way to improve the lives of current patients and families is to develop and implement postgraduate curriculums. For this reason, it is valuable to produce the lessons so they are relevant to learners and practicing family physicians regardless of whether they disclose their ACE personal histories or not.
The primary care of patients that incorporate staff of mental health clinicians and behavioral teams in patient-centered medical homes are readily available to physicians and family practices that are able to assist patients with the help of primary care by way of treatment of newly discovered ACE histories that aim to improve the quality of life of patients. Please subscribe to our channel for more useful information.